Hello, everybody. Welcome to this very, very important collaboration. My name is Dr. Joanne Michelle Martin. I am a pelvic floor therapist and the owner of JMM Health Solutions. And I have the privilege of collaborating with Rose, Reaching Our Sisters Everywhere Incorporated, an amazing group here in the Metro Atlanta area that's doing something very, very special regarding maternal health. Today, I have with me two of the leaders from Rose. I have Hallie Neely and I have Andrea Serrano. Welcome, ladies.
Thank
Hello, thank you.
And so I'm just going to let them jump right in, introducing themselves. Ladies, thank you so much for being here. Thank you so much for allowing me to be a part of this. I just want you guys to start off by telling us a little bit more about yourselves, your role within Rose, and then a little bit more about the organization. So, Hallie, let's start with you.
Sure. My name is Haley Neely. I am from Chicago, Illinois. I moved to Atlanta in 2007. I went to school at Georgia State and I started working with Rose maybe in 2018. Uh, in my previous role, I helped Andrea plan like the yearly summits, and then this year presented an opportunity for me to join the team as the development director. Under that, I work with Andrea as well. She can't get away from me. We're working on the Maternal Telehealth Access Project now, or formerly known as MTAP, where we lead a team of about 64 individuals and community-based organizations and help supply resources and materials that help them increase telehealth access.
Hi,
That,
I'm
that is awesome. Andrea, how about you?
Hi, I was clearly ready to jump the gun there. I'm Andrea Serrano. I'm the program director at Reaching Our Sisters Everywhere. I've been with the organization since 2012. I'm originally from North Hollywood, California. In the summer of 2012, I helped Rose with their first national summit. And there, Dr. Bug had extended the invitation saying if I ever wanted a more permanent place within Reaching Our Sisters Everywhere, to please consider, joining the Rose team. And so I had told my mother that summer that I'll be relocating to Atlanta, Georgia to work with Reaching Our Sisters Everywhere. Here in my role, I help support our programming, our grant deliverables, the implementation of all of our different initiatives and projects, along with collaborative relationship with other partners. On this particular project, I am really helping to coordinate the Village Innovating Perinatal Support cohort, also known as VIPS cohort. And Haley has been a wonderful asset to the team as we manage this particular project that is a part of a much larger project, which I'll be happy to share in a moment.
Wonderful, wonderful. So, since you brought it up, tell us a little bit more about the VIPs cohort. So, it is Village Innovating Perinatal Support in
Mhm.
Action. Tell us a little bit more about that cohort, what it stands for, what it means inherently to the community, to the perinatal community, the postpartum community, and all those that support mothers whether here in Georgia or beyond.
I'll be happy to elaborate, and then Haley can jump right on in with some additional information. Before I could dive into the VIPs, I think it's important to elevate like how the process even came about. And so, due to the response of COVID-19, Congress had passed the CARES Act, and so the CARES Act had funding that was specifically portions of it specifically targeting maternal health and HRSA, which is the Human Resource, Health Resource and Service Administration, had funds available for organizations to apply for the grant. So the University of North Carolina, Chapel Hill had applied for funding and was awarded said funding. And so a part of the subcontractors involved with UNC's application included Reaching Our Sisters Everywhere, National Birth Equity Collaborative, Race for Equity, National Perinatal Association, Morehouse School of Medicine, and National Area Health Education Center organizations. So quite a bit of partners involved with that initial grant process in order to get funds from the CARES Act. And with that, under that larger umbrella, UNC, NBEC, and Rose was essentially able to distribute mini grants out to communities. And so, for reaching our sisters everywhere throughout COVID-19, keeping our ears amongst our community at large, not only here in the metro Atlanta area, but just nationally, and all the stories that were going on. And many of the birth workers that we knew across this nation just talking about the struggles that they were having to be able to serve communities, given the lack of resources that they had and the expanded need that was evident because of changes to maternity care practices. And so, in keeping that in mind, we created the VIPs cohort, the Village Innovating Perinatal Support Birth Relief Fund, where individuals could apply. And we wanted to keep this a very simple process for application, as we knew that many of the birth workers were already on the ground rolling, doing work. And there had been other birth worker relief funds available throughout the summer as well. So we knew people were probably applying to those things, those various opportunities, and didn't want to make this process too extensive. So essentially, the VIPs are individuals that have already been doing maternal care support across perinatal. So perinatal, whether that's prenatal, during birth, labor, and the postpartum period, perinatal covers that entire period. And we wanted to be able to support folks that were ready to do the work and being able to expand their capacity with this funding.
That's absolutely amazing. What have you seen in terms of, I mean, because COVID has been so extensive in terms of the way that it's impacted just people in general, just the country in general. And then when we get down to the nitty gritty and we talk about birthing community, I mean, we are a very tight knit group. So we know what's going on within our communities
Mhm.
elsewhere, not just here in Atlanta, but elsewhere. And you could hear the stories, first of all, doulas weren't allowed in the hospitals. There were all these restrictions. Moms weren't getting support. Moms weren't getting postpartum support. Moms weren't getting prenatal support, like all these different things going on. But one of the beautiful things that has come out of COVID is the fact that many people have been forced to utilize technology in a way that they probably were not utilizing it before.
Mhm.
And so, as a part of this program, I know you mentioned earlier that it really does. You're giving these funds and you're helping these individuals to enhance their reach through technology. So, Haley, tell us a little bit more about that.
Sure. So, as you mentioned, there is a strong emphasis on the use of technology now, but when in our day to day operations, I think it is a very humbling experience just to kind of understand that technology isn't accessible for everyone. So, while for some populations it was just okay, we're going to pivot from in person meetings to virtual meetings, that is making the assumption that you have a laptop, that you have a reliable internet connection, and that you have a safe place to kind of call in and do your work from, or maybe attend an appointment. That's also making the assumption that you have the time to do that. And what we have realized is the things that we take for granted, or just having like a reliable mailing address. So if you don't have those resources, we can send you the resources so you can get the support. I made a lot of assumptions ahead of time, and just pivoting to telehealth and using technology. And then when I started working on this project and listening to stories from the community and from our organizations, I realized that we kind of have to step back a little bit. And so, in order to make technology as effective as we want it to be, there are some things that we have to put in place. Some of them are in our control, and some of them are, infrastructure. We can't necessarily put a cell tower there, but what can we do within our means to be able to provide support?
Mhm. So, and what have you found to be effective, let's say for moms who are in more rural communities? Because the city areas, more often than not, at least, we can probably assume that at least in terms of technology, we've got that covered. It would just be the need. So, do they have a phone? Do they have internet access? Those types of things. What about the rural communities, and what have you guys been able to do, or what things you guys intend to implement, even if not now, futuristically, to help more people within those communities?
That is a beautiful question. And one of the things that we had did with this project, not specifically with the cohort, but through the larger umbrella of the project, was listening sessions throughout the summer, talking to families that were already experiencing telehealth and some of the challenges and barriers that they were encountering, what were things that they would like to see put in place to help address it. And one of the key things that kind of came out of that recommendation was we cannot solely rely on telehealth. We need to have home visiting incorporated um, into this process. And so I think one of our biggest recommendations moving forward, especially to the larger funder at hand after those listening sessions, was the importance of funding home visiting programs, including the supplies that they need in order to do the in person visits. In that way, the technology can be utilized for the in between checkups, but there are things, especially in this perinatal space, that requires in person assessments.
Hmm. I absolutely and totally agree. One of the things that we focus on, and I think it's gotten a lot of media attention over the last several months, especially around about the summer, we started hearing more about maternal mortality rates, especially within marginalized communities, more specifically within Black communities. Um, what do you guys typically see? What have you heard from the cohort with regards to that? Is it lack of education? Is it just lack of access? Is it lack of funding? What have you guys noticed? And then what do you think needs to be done in order to kind of, start to stint those rates and kind of move them in the opposite direction so that we aren't having these 30-40% rates, maternal deaths. Like
Mhm.
Black women aren't dying 5 times plus more than their Caucasian counterparts in birth. What do you feel like needs to be done there?
Well, COVID-19, what it did was it elevated the problems that were already existing. And in order to truly address the problems and the issues that impact our communities, it has to be open and acknowledgement and action against systematic racism, because that is the key thing that is attributing to both our maternal mortality rates and our infant mortality rates. Like, that is the important thing. um, I almost want to drop the mic there, but
Sometimes you have to.
but to add in the additional layers and additional factors is recognizing the importance of community-based health workers, doulas, midwives. Those already embedded in the community have a trusting relationship with families, and that makes the significant difference in having that respectful care. Whereas a person seeking support, you can know that the provider in which you are talking to genuinely cares and going to offer you the best recommendations or best support needed. And I think I've heard a lot of that not only in the listening sessions, but when we hear that women are, especially Black women, are in fear of birthing in the hospital. There was some of the fear already there due to the knowledge and awareness around maternal mortality, and then through this experience of different maternity care practices due to COVID-19, it increased the fear of going into the hospital. You know, that notion of, am I going to have to go in there by myself, deliver by myself? Am I going to have to wear a mask during this delivery? Can no one come in and visit me? I can't even have my partner, because there was a time in the beginning of the pandemic where, significant others, care partners, could not go in with the birthing person. And so all of those things layered into a fear of delivery in the hospital to a degree, and you had a large influx of individuals having home births. And our uh, sisters in Village and Arms that do community-based support and do home births and so forth were influxed with the number of people that were wanting this service. And that was definitely something that came up in great conversation, not just nationally, but especially here in the metro Atlanta area.
I think that's a beautiful thing. And I think that, when we acknowledge, I know that, and I'm kind of like in limbo, me being a pelvic floor therapist and being embedded in the medical community, and me also being a birth doula. So me being embedded, like I'm kind of like dancing that fine line between both worlds. But I think it's a beautiful thing because when we look at home births and the home birth structure, especially for those women who don't have prior existing conditions,
Mhm.
when they're not high risk, when everything has been going relatively well during their pregnancy, they make the best candidates for a home birth.
Mhm.
And I feel like we could encourage that a little bit more. This is something that's not new. This is certainly
Mhm.
something definitely not new. I mean, it's been going on in other cultures and other communities outside of the country, even here within the country in a lot of communities. I mean, if we even kind of bring the history back up, that's how a lot of our ancestors and our
Mhm.
predecessors came to be because
Right.
we didn't go to hospitals.
Right.
So I mean, I think it's a beautiful thing. What and then tell me a little bit more about the cohort. So tell me a little bit more about what groups do you have? What types of clinicians, practitioners do you have within the cohorts? And what are kind of some of the areas of service that you've seen have been brought up because of this?
Eva, go ahead.
So can you clarify the question? I apologize.
You're fine. So based on the cohort, I know you said there are about 64 different recipients of the cohort. What types of clinicians have you seen within the cohort that have been providing services? And have you seen an elevation of these services just overall as a result of being able to have that assistance and just, because of the pandemic at large?
Sure. So our cohort, like I said, is a mix of 64 individuals and organizations. Some of the organizations are, I think we have a hospital, maybe a very small community-based
Mhm.
hospital. We have a couple of midwives, doulas. I want to say maybe nurse practitioners, perhaps.
Mhm.
And the terms of the service, it ranges. So we have some individuals who may need like a Zoom subscription, and that can be an added benefit, especially if they're having a hard time scheduling meetings with the families that they're serving. But then we have provided resources like iPads and laptops, which can be an added benefit for a different community. I know that we fulfill requests for maybe bus cards, so if they do need in-person support, they can have that option as well. But we do get an overwhelming response that, if nothing else, they are able to have a reliable resource or tool to schedule appointments and have phone calls. And now they don't have to necessarily give away services for free. They can be compensated for their time, which means they can host more sessions or more classes or have a monthly calendar full of events because they know that they will be compensated in some capacity for this resource. And then they'll be able to provide additional materials for the families that they serve as well.
Mm-hmm.
Right. And to add to that, like Haley said, we have the doulas, we have lactation support providers, we have those that operate in a more prenatal space, some that operate more in a birthing space, those that provide more postpartum support. We have some mental health support providers as well. One other organization who also does translating. So they're a big advocate on the translation of information from English to other languages, particularly Spanish. And we noted that during our listening sessions, that is a huge
That's a huge
issue,
need.
huge, especially now. Before it's already a problem, but it's even worse now that if you English is not your primary language, it's almost like you are completely lost in the sauce now when it comes to support, because most handouts, materials provided are usually going to be in English. Most providers that are going to be interacting with clients are English speaking, and some things don't fully translate well when you're not having the native speaker translating the information. And so we have a nice variety, but most are operating somewhat in that birthing space, whether it be midwives, doulas, lactation support providers.
And I wanted to add that when we hosted our listening sessions before we even began the project, we made sure that we hosted two listening sessions in Spanish, and then we hosted a listening session for the Native American community. And that way we can kind of hear from diverse populations and know that the services that we were providing were needed all across the board instead of just one specific area or something that's close to Atlanta.
I think that's amazing because you're right in terms of the fact that we do have a pretty large Hispanic population here. I mean, we're pretty diverse in Atlanta, but I don't know that the amount of clinicians supports the need, that exists with individuals who speak a foreign language. And it's really, really hard, especially if they don't have the support with family members that can translate, or the physician doesn't have the support with a translating system and or service, to come in and assist. It's really, really difficult for those individuals. So that's amazing. What do you find, or what have you found in terms of morbidity? So we always talk about the mortality rates. We
Mm-hmm.
always talk
Mm-hmm.
about all the moms and all the babies who don't make it within that first year. And we don't often talk about the morbidity rates,
Mm-hmm.
which is all
Mm-hmm.
of the things that carry on. We kind of forget that, right? All the things that occur as a result of that pregnancy, that labor and delivery, including birth trauma, which
Mm-hmm.
is pretty common, and which many individuals have reported experiencing throughout this COVID period because of just changes in hospital practices and so on. But many people don't really talk a lot about the morbidities and all the things that can carry on after the fact. So even after that first year, into that second year and beyond, maternal mental health,
Mm-hmm.
poor breastfeeding outcomes, poor pelvic health, poor health in
Mm-hmm.
general. We start looking at the infants. Are they getting the care that they need? Are they developmentally on par, with children their age, with their peers, and where they need to be? What have you found, or what have you been hearing from the other professionals within the cohort, the mental health therapists, and so on? Are they themselves feeling overwhelmed? As in, do you feel like there's going to be more of a need for things like this and programs like this to be implemented?
Yeah, that definitely has come out that that has been an additional need. And in those that may not be mental health certified, are looking into trainings that help with trauma informed care as far as the VIP cohort. And then in the larger project sense, that has been something our organization has elevated consistently amongst the partners, that there is going to be a serious need of push for mental health support throughout, next initiatives, because 2020 is and was, well, because we're in 2021, but the trauma still continues, has been a very traumatic experience across the board. And that's going to have an impact on families, and resources on trauma informed care is going to be essential. So we have definitely elevated those needs. And like I said, the home visiting aspect, that funds need to go into home visiting, because like you said, when it comes to looking at some of the comorbidities that are impacting families in the postpartum period, there's only so much you can sometimes see on a screen, right? Can you see the blanching of a person's face? Is it coming up clear enough to be able to do some of those assessments? Families that are having cesarean sections and needing to be able to get really checked on,
Mm-hmm.
right? So, the bridge to that is people need to be seen in person to a
Mm-hmm.
degree. And that's where we need to address having those programs that, happen. Nurse family partnership has been something that has existed. These are programs that need to continue to be elevated. And our thing is really honing in that trusted members of the community already doing the work
Yeah.
need access to the funds that will support the work.
Yeah. That's super important. That's very, very important. And the big key here is community. We got to keep building the community. We got to keep lifting the community and pouring into the communities. I think that's where a lot of the work is. And you're right, where people are seeing it. If you're not there in the midst, you kind of can't really see what's going on, and
Mhm.
and what the needs are, and understand what people are talking about and what their struggles are. So I think that that's really, really key. What other visions do you guys have for this program, and then maybe for improving and enhancing? I know you guys have talked about some of the sessions that you've had. What more has come out of those? Where do you guys see this going?
I would like to see just basic support provided. So this opportunity unfortunately does end in April, but we know that there will be a deeper need far beyond the program completion. So just kind of implementing something to where families and providers can still get the support that they need, even though the funding opportunity has ended. We're still in the pandemic, and I imagine, as much as I would hope not, that we will still maybe dealing with some effects of it even in April. So what do we need to do to put in place that if this were to happen, or if families are still, not really feeling comfortable with going to the hospital, are there parameters for them to still receive support? And that's probably it for me. What about you, Andrea?
I have a few things on my wish list, but I won't go through all of them. I'll
Tell us everything.
I'll
Give me
point
all
out
the goods.
I will point out some key things. One is that funding opportunities need to be accessible to community organizations and members doing the work. I find that some of the biggest funding opportunities and some of the ways that they're laid out, do perpetuate institutionalized racism and makes it very difficult for community-based organizations and individuals to access the funds when they are already doing the work. And I hope that what we've been able to do with the VIP cohort and other organizations that have stepped in and mapped out funding opportunities with an equitable lens can be lifted even to a more broader range on how we look at funding organizations and individuals within the community and trusting their ability to do the work, and also restructuring on how they measure success, right? Because it's the model of how people have to report back, and the measurement of success can also be steeped in institutionalized racism. And so what you might be defined as an institution as success may be different than what the community is identifying as success, and that should be what leads. The other thing on my wish list is recognizing that everyone that has been funded through this project can say that they were funded under the CARES Act, and be able to elevate that to continue to strengthen their funding opportunities for applying to other sources and sustaining these projects, because it's going to be absolutely necessary. We look at where we are, here in January 2021 in relation to the pandemic and COVID-19, and it's clear that a lot of things are not going to change too much from what happened in 2020 on social distancing and how care is provided. And so it is a complete need for this hybrid model of care. And so it would be essential for funds for these projects to continue to be funded to sustain their work. And so that is a key part of my wish list here. And the other thing, last but not least, is that families continue to be centered in the approaches and the work that's necessary to meet their needs, and should always be listened to and identified as the experts for the solutions.
That's huge. That's really huge. And a lot of those points there, because I mean, it's not rocket science, right? It's not rocket science. You think, okay, and that's something even in birth that you think, okay, a lot of doctors may say, for example, this birth was successful because it was a vaginal delivery, let's just say. But the mom comes out of that feeling trauma because, even though it was a vaginal birth, even though there was, it was a seemingly normal delivery, one of the things that we talked about with trauma informed care is it's not what you think, it's not your perception, it's always the perception of the patient. And that's important because that's where the solution lies. And I just want to echo that because that is so huge. And I think we as a society, healthcare, allied healthcare, when we start working with people, in order to elevate them, we got to listen and we've got to bring their issues up. Like it's not about us. It's not what we think. Right. And so I think that that's huge. I mean, in terms of like even talking about like some of the goals and success, are there any specific objective measures like that you guys have found to be effective, throughout, or are you guys finding to be effective as you go through this cohort?
So, for our objective measures for this particular project, our key things was that we would be able to provide the resources that families requested. So, part of the project included a family connections form. So, we had
Mhm.
specific funds set out to be able to support families with their individual needs that the cohort members would be able to identify. So, that was a big thing for me because for the organization overall, not just me, but the organization overall. Because so often we talk about, all right, we're going to institute a project that's supposed to increase the access to resources, but then that access point, do families actually have the access point to be able to utilize that resource? So being able to, our goal is to make sure that all the regions, so the cohort members fall into the 10 HRSA regions, and the 10 HRSA regions represent the entire United States. So we want to ensure that every region is represented as far as resources that are provided directly to families. We want families to be able to indicate that through this opportunity, that they have been able to receive respectful care, and that it has improved their own goals and health outcomes for themselves. And that, for the VIPs that have participated, that have joined and been a part of this cohort, for them to feel that this has provided a resource opportunity. So often, when you are part of a funded project, you as a grantee, because we know this, we've been grantees plenty of times, constantly feel like you're giving all the information, giving all your information, all the resources and things that you've done. And sometimes you don't always feel as enriched outside of the funding you received, right?
Mhm.
Like to be able to move forward. And so we're hoping that through this experience that our VIPs, who I hope you all enjoy listening to through the rest of this series, are able to say that they feel enriched through being funded through this project.
Yeah.
And to help establish a sense of community, I think on one of our calls, we do like these open forum weekly check ins. And it just so happened that one Wednesday we had two members who were in the same state. So, how great is that to kind of build a sense of community? Someone who's doing similar work as you, who's in the same neighborhood as you, possibly, and you all are funded by the same project. So, I was just imagining like different opportunities as they come along, you can kind of share. And if you ever kind of need somebody to check in with, you have someone that is doing something similar right in your
Mhm.
back pocket.
Yeah. Yeah, continuing to elevate even through community. That's amazing. I mean, I absolutely love this. I myself was a recipient. I'm a pelvic floor therapist, and I think one of the biggest things for me is that care is so limited. And I've been able to offer, complimentary telehealth sessions to pregnant women and postpartum women as a result of this. Something that they probably otherwise would not get, because I'm not an in network provider. I typically don't take insurance, which is
Mm-hmm.
one of the things that people always say, we can't find somebody who takes insurance. We can't find somebody who takes Medicaid or most of the state funded insurances and all these different types of things. And I can go down the rabbit hole of why we don't
Right.
like insurance, but but the thing about it is that, what other ways can we serve? And I think that this was a great opportunity to be able to help, uninsured women, or women with some of those state funded insurances who do need pelvic. I'm like, ooh, Lord, like you need me, you really need
Right.
me.
Yeah.
But they've been able to get that, or to conduct classes. And usually, instead of, so now instead of charging for classes, I can say, let's have this as a complimentary class. So now you get to benefit from this education. You get to benefit from, Q&A after the classes, where you get your questions answered that you would usually have to make an appointment to go get done, or to, go pay to see somebody. But now you can have that within a class. And I had a class with 50 registered just last week. And so, I mean, like it's been a really huge blessing to be able to do that for other people. So I hope that you guys are able to continue, um, you know, even beyond this program to kind of really seep into more communities and kind of be able to elevate and uplift them, because I think it is powerful. um, People recognize it. I think the recipients recognize it. They certainly do appreciate it. And it's been a blessing. It's been a huge, huge blessing. So before we wrap up, is there anything else that you guys would like to add with regards to the program, with regards to any other initiatives that Rose may be doing? Tell us anything, any last or parting thoughts.
Um,
Go ahead.
I was gonna say, try to make sure that this project was as sustainable as possible. So our team did a really good job with putting resources in place now. So when the funding opportunity does end, that our folks feel empowered and have the know-how to continue on. So we hosted a grant writing workshop last week that was almost 4 hours, and I didn't realize how impactful that would be until they start kind of chiming in during the session. And that was one of those in moment experiences. Like, you don't really realize the effect of the work you're doing until you're kind of like knee deep in it. And so,
Mm-hmm.
something that I thought was like, maybe they'll like it, maybe they'll love it. Everybody was just like, oh my God, this was the best thing I've ever done. And I'm just like, this is a 4 hour session. I feel bad for putting this on your calendar. And the response was just incredible. And we don't get those moments too often where we get to see our work being reflected in a positive way immediately. So that kind of made me feel good. It made me feel like, you know what, I have to make sure this is successful because it is changing lives. It does matter. It is working. And we have to keep going.
Mm-hmm. For sure.
Yes, I will have to say, and it's probably why I wore the sweater today, that the VIPs have been the star for me for 2020. Okay. It has been despite everything that goes on, because sometimes some of the conversations we have to be in other spaces can be very difficult. But the VIPs have been the star to my 2020, has been the North Star, the leading star for me to keep going and putting in that energy and effort, because I feel like this has been the most rewarding and beautiful experience to be amongst such dynamic, phenomenal individuals across the United States doing powerful work. So
Mm-hmm.
that is one of the things I'm the most thankful for.
That's awesome. That's awesome. And so, as a part of this collaboration, we will be interviewing other recipients within the VIP cohort, other professionals, be they doulas, midwives, lactation consultants, mental health providers, whomever else within the cohort, within other areas that will get to talk about their community. Struggles, successes, programs that they've been able to implement and things that they would like to continue to see for the future. So I'm really excited to sit down and listen into all these conversations, soaking it all up. This is really amazing. And just being able then to share that with everybody. So, those of you who are listening to this, continue to tune in. Haley, where can they find more information about Rose and all the things that you guys are doing within the community?
Sure, they can find us on the internet. The
The
website is
interwebs.
breastfeedingrose.org. Andre, do you know the Twitter and Instagram handles? Oh, the
Yes,
Instagram. Okay,
it's
you go.
they're both at support_rose for our Twitter and our Instagram. And then Facebook is facebook.com/breastfeeding rose.
Awesome. And you guys do a lot with breastfeeding as well. Any other community programs that you have available that you care to share with any of the listeners?
Certainly. So, Tanisha Sellers, who is our community transformer coordinator, would be very upset if I did not mention our breast friend training dates are going to be going live on our website soon. So, what our breast friend is, it is a training program we developed to train individuals who want to support families through the first 8 weeks of the postpartum period, being a master affirmer and being able to provide those tips and, things that families might need during that early breastfeeding journey. While we were doing the African American Saving Tomorrow Today breastfeeding blueprint, also available on our website, one of the things that we noted in PRAM's data was that specifically for African American families, breastfeeding rates go down 21% each week. post-birth. And so we developed this program to at least provide that concentrated support during that time. We navigated through 2020, bringing this training from an in-person to an online training opportunity. So visit our website. Training dates will be posted soon, and you'll be able to register. And it's not for a specific area, so it's not just Atlanta. This is, as long as you want to come for the training dates and time, online, you can participate.
Awesome. And guys, you will be able to see each and every one of these interviews on the JMM Health Solutions YouTube channel. We're doing a series, so it will be the series of all these videos. VIPs in Action is what we're titling it, and you'll be able to see all those available right there, as well as on Rose's YouTube on their website. So if you are a part of their community, if you're part of my community, we want this information to grow far and wide so that other people know what resources are available to them. We can help to continue to support more individuals within the perinatal community, and just continue to lift our communities up and make them so much better. So ladies, thank you from the bottom of my heart. This has been amazing. I look forward to seeing where all of this goes. I look forward to seeing, continuing to see all the great work that you guys are putting into the community and just the amazing results that I know that will happen collectively from the cohort.
Thank you. Thank you so much for having us.
You're welcome. Awesome, guys.